So this is the EMT course, and we're going to begin with Chapter 1. We're using the Emergency Care 13th edition by Daniel Limmer and Michael O'Keefe. And this will be a good resource for you throughout your EMT course. Be sure and read the book, number one, but number two, study it and take in some of the critical highlights and make use of the pre-tests and post-tests, and that will help you to get a better understanding of what it is to be an EMT and how you can also prepare adequately for the EMT test. If you look at the beginning of each chapter, you will see that they have what they call objectives. Each one of those objectives are things that you need to know. All the test questions are based on objectives. So if you understand what each objective is and how to implement them into the critical concepts, then you will be able to do well on the test. So we'll begin on Chapter 1, page 3. Follow along in your books, and you can maybe point out a few things. This will also help you in studying and preparing. The emergency medical service systems, as we know it today, has developed over a long period of time. In the 1790s, when the French began to transport wounded soldiers from their battlefields, they were cared for by physicians after they were transported from the battlefield. So this actually is the earliest documented emergency medical services. They didn't really provide any emergency medical care. It was just basically a transport. And then in other wars, there were also similar services. In the Civil War, many of you might realize that the American Civil War, Clara Barton was actually the one that helped establish what we know today as the American Red Cross. And then in World War I, there was a lot of volunteers that had what was called a battlefield ambulance corps. And even today, we have the more modern concept of MASH type units. We have military medics, and the military is a great source of helping our EMS system to grow and improve, because it's used somewhat as a way of identifying best practices and practices that work. In the non-military ambulance view, the actual ambulance system as we know it today actually began in the 1900s in the United States. And communities across the whole United States really saw that they needed some emergency care services, and it was developed in a number of different ways. Some places the emergency medical service was operated by hospitals. Some communities developed fire departments that went out and also provided emergency service. And in the early beginnings, the more common way of getting to the hospital was through the hearse, and the funeral homes actually ran the services. Whether you were injured or whether you were killed, they found a place for you to go to. There was no requirements or standards for equipment, crew training, or ambulance design at that time. It was in 1966 that the Department of Transportation was actually given the authority to develop emergency medical services standards. And this was a result of something called the White Paper. It was a research, a study, which really pointed out the fact that a lot of people were dying and even becoming disabled for life as a result of not getting emergency medical care quickly, or even getting to the hospital quickly. And so the Department of Transportation, the federal agency, was actually charged with developing the EMS standards. And with that regards, the National Highway Traffic Safety Administration actually was the ones that developed those standards. So NHTSA, National Highway Traffic Safety Administration, operated under the Department of Transportation direct authority and helped to develop the standards as we know them today. If you look on page 4 of your text, there is a whole list of standards that they actually developed, the NHTSA standards. It's regulation and policy, resource management, human resources and training, transportation, facilities, communications, public information and education, medical direction, trauma systems, and evaluation. This slide is telling you also about in 1970 is when the founding of the National Registry of EMTs was founded. The National Registry of EMTs is actually the organization that develops a standardized way of assessing whether an EMT or a paramedic is actually meeting minimum standards. So if you so desire, at the end of this course, you will be able to take a National Registry EMT test and then become a nationally recognized EMT that would allow you to be licensed virtually in any state in the United States. In 1973 is when the National Emergency Medical Services Systems Act was passed by Congress, and this was another development with National Highway Traffic Safety Administration.
In 1869, the Bellevue Hospital Medical College introduced the first ambulance service in the United States. The service was established to transport civilians to the hospital. Interns rode in these ambulances, doing whatever they could to comfort the patients. By the 1890s, this idea spread to other large city medical schools and hospitals. Yet by 1950, many small towns and rural areas still had no ambulance services, some offering little more than transport by the local funeral home. Over the next 20 years, however, great strides in ambulance transportation took place. Most significantly, the extension of the hospital emergency room, or department, to the patient through the Emergency Medical Services, EMS, system. With this advancement, care could begin at the scene, continue during transport, and then be handed off to the staff in the hospital. By 1966, the National Highway Safety Act was passed, granting the responsibility for developing standards for training, assessment, and care to the Department of Transportation, DOT. This standardized EMTB training, assessment, and care. A fully standardized First Responder National Program was presented in 1994. Often, it seems that EMS response is a given, but its development and spread has taken well over 100 years.
So, just a review of the NHTSA standards. Once again, it's on page 4 in your books. Regulation and policy. Each state actually has been given the authority to establish laws, policy, and regulations for emergency medical services. And it's usually put under a specific agency that's a lead agency. It also needs to exist as a funding mechanism for funding EMS throughout the state and the nation. So in Illinois, the regulation and policy is under the Illinois Department of Public Health. This policy is also the same in Iowa. It's under the Iowa Department of Public Health. This isn't true in every state. Some states will maybe put it under licensing agencies or some other agency. The next standard that NHTSA oversees or helps to produce or set is resource management. This is the centralized coordination of emergency treatment and transport services. There needs to be centralized coordination for all the victims of trauma, and everybody in every state and every area needs to have equal access to the basic emergency care and to be able to be transported by certified and licensed ambulances. Human resources and training. This is to make sure that at a minimum all EMS personnel are trained and meet certain qualifications, especially the ones that are transporting and the ones that work in ambulances. At a minimum, generally the EMT is the basic level to be taught to work on an ambulance. Transportation. It provides safe, reliable ambulance transportation, and this is actually a critical component of the standards. Some people need to go by ambulance. Some people actually need to go by helicopter or airplane. So there's specific needs that can be met, and you can see that there's all different kinds of vehicles out there that people respond in to help people, but those that are actually being transported critically are have to meet specific standards, and they are called the KKK standards that were initially developed to make sure that the visibility and the safety of the transportation vehicles met a certain standard. Facilities. Generally, you transport to the closest appropriate facility. Emphasis on appropriate. Sometimes the closest facility is not the most appropriate if it's a facility that cannot care for that particular individual. It depends on the patient's condition a lot, but nowadays when it's many critical trauma patients, if you have a choice between a local hospital that has very, very basic or minimal ER services or a 5-minute farther hospital that has fully capable trauma and surgical capabilities, then maybe that patient that needs a surgeon might be better served to go the 5 minutes farther to get to the facility that can adequately fix them. Communications, and there needs to be an effective way for people to access an ambulance, and this is generally through the 911 system, and most people recognize that as the national number to get an ambulance when they need it. And then we've got public information and education. EMS people are some of the best people to promote education and information to the public. And we see some of the more critical things and the accidents, so to say, that can be prevented. So some programs that are good for public education is maybe the seatbelt law and promoting wearing seatbelts. It has saved lives. The bicycle helmet or motorcycle helmet and the safety with people that have been survived serious injuries because they've worn safety equipment. Medical direction. Each EMS system must have a medical director. He is the person that oversees your protocols and the care that is provided by EMTs. And they need to be involved in all aspects of the patient care system. Trauma systems. NHTSA standards has been hugely responsible for developing trauma systems and the ability to triage people and to take them to the appropriate facilities and actually provide the appropriate treatment and protocols. They're heavily involved in research and evaluation. Each state must have a program for evaluating and improving the effectiveness of the EMS system, and this is called quality improvement. This helps us to improve our best practices and maybe refute the practices that aren't necessarily helping to save lives. So let's talk about some of the components of the EMS system next. Generally, the EMS system is a group or a number of resources that help to provide the emergency care. And it all starts with actually an initial phone call. And that phone call is picked up by emergency medical dispatchers for the most part. An EMD, an emergency medical dispatcher, is somebody who answers the calls and dispatches the appropriate resources by asking specific questions that will help to categorize what type of resources they might need. And then, of course, the EMS responders are next, and there's all levels of EMS responders, which we'll talk about just a little bit later. And then the emergency department or hospital, which involves a whole group of people. We've got our emergency doctors, our specialty doctors, our nurses, and any allied health professional that are going to help to care for that patient. Some specialty centers are actually set apart from other hospitals. These hospitals have specific capabilities. One of the type specialty hospitals might be a trauma center. In some hospitals, a surgery team isn't available at all times, and trauma centers will have surgeons available 24 hours a day, 7 days a week. And there's other specialty centers too. There's children's hospitals, there's orthopedic centers, and that sort of thing. So here's a list of our other specialized care facilities. We've got trauma centers, burn centers that specialize in the patient that's been burned, pediatric centers, cardiac centers, and even more prevalent that are starting to come into play just more recently are the stroke centers. And here's a look at how you might view your trauma patient as they're brought into the emergency room, a whole team of professionals that'll be taking care of them. So I want you to think about your community and what medical services might be available in your community. You might know, especially in the Nauvoo area, that there are EMTs that work on the ambulance with a basic life support ambulance in the fire department. Other communities might have a standalone ambulance service that not necessarily is involved with the fire department. And then there's still others that might have an ambulance that is based out of the hospital that goes out into the community. How important is it that you know the capabilities of a community medical facilities? Well, if you're an EMT and you're going to be working on an ambulance, it's helpful to know which facility is going to be able to care for your patient's needs the best. And what are the possible consequences of transporting the patient to a facility not equipped to handle the problem? Well, on an average, there's laws in place. When one hospital transfers to the other, they have to guarantee that the patient is stable enough to be transferred and that they're not being transferred solely because they can't pay or they don't have insurance. And so these are called EMTALA laws. Well, sometimes it takes a while to arrange transport from one facility to the other, and a patient's actual care can be delayed from anywhere to 1 to 4 hours, depending on how quickly that patient or that hospital can assess and evaluate and then move the patient to the hospital that can actually care for them. So assessing the patient from a patient's perspective, you want to look at the EMS system and how you will view it if you were to be traveling and gotten an emergency. You would want to know just how it is you would receive care and what is the process. So put yourself into the patient's position, and then if there was an accident, say an automobile accident, you would call 911, and this is almost similar to the American Heart Association chain of survival, but it's a more generalized look at it. So a citizen calls 911. The person that's going to answer that call is the emergency medical dispatcher. They will be dispatching resources to where they need to be. And in some places, you will see the first level of emergency medical care respond, and that is an EMR. A number of years ago, the emergency medical responder was just simply called the first responder. But this is the person that often arrives first at the scene. Sometimes they're a police officer, sometimes they're a firefighter. It could be a health industrial health person if they're in a industrial facility. This person is actually emphasizes their role is to activate the EMS system and just provide basic immediate care to life-threatening injuries. They help to control the scene, and mostly they prepare for the arrival of the ambulance. The next level is the emergency medical technician, and this is what you will be completing when you finish this course, and it is considered the minimal level of certification for an ambulance person to achieve, to work on an ambulance. The next level is the advanced EMT, and this previously was called the EMTI, or the EMT Intermediate. And the advanced EMT provides basic level care and transportation, and then also gives a little bit of advanced level care, including an advanced airway, or they can administer some medications like IV medications or interosseous medications that go directly into the bone. And then you have the paramedic, which is the highest level of care, which provides a lot of the services that a basic emergency department might provide. And then once that person is transported, they'll be transported to emergency department staff, and it's the entryway into the actual health facility, and from that point they will be admitted and cared for by other health personnel. So accessing the EMS system involves calling 911, This is available on most communities. There's a difference between 911 and enhanced 911. Enhanced 911 generally provides the caller's phone number gets displayed when it comes up, and also the location for the call based on if they're calling on a landline or if it's a cell phone that's being utilized. These are only picked up as special, they've got to have special equipment to receive cell phone calls. So you want to, if you're using your cell phone to call 911, be sure you know where you're at so that you can make sure you're connected to the right facility, 911 facility. Emergency medical dispatchers then are the ones that they differ from regular dispatchers. Emergency medical dispatchers can actually provide instructions to callers on how to provide emergency care until the EMTs get there. And in some systems, EMDs are required, and they are actually licenses. In Illinois, I believe it is a license level, and they need to have recurrent training just the same as EMTs do. So in EMS, one of the skills you're going to be learning in this class is how to make some critical decision-making skills. So if you look on page 7, there's a little critical decision-making box. And this is something that you should read through and kind of get an idea of what types. I like to say that EMTs are being taught to make life-saving decisions in seconds. And so critical decision making is a very important concept that you should understand and practice. You may need to decide which hospital to transport someone to, or deciding whether you should give a medication to patient or not, depending on what their status is. So this is a concept that I want you to look for as you go throughout the book. So here's an example. Which hospital to go to, or is the patient stable enough to go further to a hospital that might be able to care for their condition a little bit better, or will this patient be better or worse depending on how long you are transporting them. And we're back to our levels of EMS care and the various levels of training. You can also find those on page 7 and on 8. We've got the EMR, the advanced EMT, or the EMT and then the advanced EMT, and then the paramedic. Be sure and know the differences in skills as far as what each level can do. As an EMT, you're going to have certain roles and responsibilities and some traits that you'd like to maybe portray. If you've ever been cared for by an EMT, you want somebody that's going to be empathetic, somebody that's going to care for you and treat you in a competent manner. And here's some traits that you would look for in that person. Personal safety, number 1. Being an EMT, you can get into some pretty hairy situations, and the scenes aren't always safe that you're sent to, and that's not, on purpose. Sometimes people just don't relay that information of what's actually going on when they call 911, and there's certain dangers. There's other things you might run into. There's animals, there's unstable buildings, fires, explosions, car accidents, any number of things that can be unsafe to you. So one of your roles is the safety of yourself And that is your very first responsibility. And then the safety of your crew. So if you have a partner, your safety and then your partner's safety comes next, and then the safety of your patient. But you're also responsible for the patient's or the safety of any bystanders. So if you in entering a situation that might be potentially dangerous and you're seeing people milling about, you may need to help to remove them and protect them from any hazards that might be they might be in danger of. But it is in that order: your safety, your crew or your partner, your patient, and then bystanders. So patient assessment is also a responsibility. It's one of your most important functions when you want to find out what's wrong with your patient and provide the appropriate care that they need. And then, of course, lifting and moving. Usually EMTs are involved in transporting patients to the hospital, so you do have to lift them and move them when they're not able to lift and move themselves. And that's based on your assessment findings. That means you need to be flexible and you need to be healthy. Transporting. This is a serious responsibility, and operating an ambulance can be dangerous. You need to be aware of safe operation guidelines, how to secure your patient, and then also care for your patient while you're in the ambulance. Transferring care. When you get to the hospital, you're going to turn that patient over to the hospital, and you want that transition to be smooth and complete, and the care that you begun to be continued by competent, and that part of that is relaying pertinent information to the people that are going to be caring for that person. And then one of your other duties would be patient advocacy. You are an advocate if you are the person that's speaking up for your patient and pleading his cause. It's your responsibility, especially if the person cannot care for himself at that time or cannot stick up for himself. You're going to develop a rapport with the patient. You're going to have a little bit of interaction with the hospitals, and it's up to you to keep that level of competency and respect among everybody that you come in contact with. So, how would you impact an older adult patient if they were transported to the hospital without glasses, hearing aid, or dentures? Well, that's a scary thing, first of all, to be transported to the hospital. So if you're an older person, you rely on your glasses to see, it would only make sense that you would want your glasses to be with you. And that might be a concern for an old person. So look in as you're transporting them and say, is there anything that you need as we go that we can take with us? Now, that doesn't mean we're going to take the dog or, a suitcase or anything like that, but whatever we can do to ease their anxiety. On a routine call, would taking the time to gather these items have a negative impact on the patient's care? Probably not if it's a routine call. If it was an emergency and the person needs to have some critical interventions done and you need to get him to the hospital more quickly, stopping to gather up these things may not be ideal. But if there was that time and the patient is stable, doing everything you can to ease their anxiety is going to be helpful. How about assuring their home is secure and locked before leaving? That also is a concern, especially if they're by themselves and they live by themselves and there's nobody that's going to secure the place for them. And another aspect might be if they have pets or animals that need care for. Could the concept of patient advocacy also extend to the community, like having fall prevention programs for elderly, or poisoning awareness, or pool and water safety programs for children? Well, of course, any way that's going to promote safety or ensure good health practices in our community is going to be an advocacy project and potentially impacts your profession. Some physical traits of a good EMT would be being able to lift and carry equipment and patients up to about 125 pounds. There are a lot of devices out there that are helping us to lift and move without hurting ourselves, but it's a common injury for an EMT over years to develop back problems. So learning good lifting and carrying techniques and how to safely carry people is detrimental to your longevity as an EMT. Good eyesight, distance and reading, being able to read and see what is going on. And this even might extend to whether you're colorblind or not. Good communication skills, both orally and written. You need to interact with people. You need to develop a rapport with your patient, with your workers, and with the other healthcare individuals that you come in contact with. Personal traits of a good EMT would be somebody that's pleasant, somebody that's sincere, somebody that's cooperative or resourceful. Being pleasant when you're the one that chose this profession, and it's a good profession, and it's an honorable thing to be an EMT, and you are a pillar of the community when you become an EMT. People look up to you. For you to walk into their house and be there and say, "Well, I'm here to help you," does not portray a positive view of the profession. And really, for the patient that you're responding to, yeah, they need your help. They called, but they called you because you were the one that stepped up to the plate and said, "Yes, I can do that for you." So be pleasant about it. Be sincere. You are coming in contact with people that are, for the most part, going through one of the worst days of their lives. Let's try to minimize it for them. Be respectful to them. Treat them nice. Dressing appropriately. It's hard to dress in a uniform when you are a volunteer in a small town where you may or may not get a call, weeks at a time. But trying to stay clean and your personal appearance would inspire confidence, and this is one of the best personal traits to inspire confidence in your patients. We can't always be 100% clean, but if you're volunteering, but we should make every attempt to try to be that way, even if it's in the middle of the night when you've just got out of bed. Be a self-starter. For the most part, as an EMT, if you're not type A personality at this point, you probably are going to develop some type A personality characteristics. Become a self-starter. Be motivational. Those of you that have signed up to take this EMT class, you probably are a little bit of a self-starter. Now it's your goal to develop and become even more of a confident individual and independent being by finishing the class. Emotionally stable, and this is something that you don't want to be emotionally cold, because you need to be empathetic, but just trying to control your feelings and not have aggressive or violent tendencies. Being able to lead. People are looking to you for answers in a chaotic time. It's up to you to be able to go in to the chaos and take control of it and bring it onto some measurable control. Be neat and clean. Be of good moral character. Be respectful of others. This allows them to trust you in situations when they really need somebody to trust. Be in control of any personal habits. try not to smoke in the ambulance, or uh, do anything that could be pretty gross. Um, be controlled in conversation and able to communicate properly. Be able to listen to others carefully and gather information from them, and then be non-judgmental and fair. Sometimes we are responding to people when they have done something that you might feel is not the smartest thing to do. And believe me, they're usually paying the price for whatever they have done that isn't smart or safe. And they don't need somebody there saying, well, gee, that was a stupid thing to do. But you need to treat people equally, regardless of their race, their color, their religion, their culture, or even something they may or may not have done. You're responsible to maintain that education. Your profession will change over the years. EMTs learn new things. Medicine is constantly changing, and research is changing the way we practice. You're going to maintain this knowledge through refresher courses, through continuing education courses. You need to have those hours to renew your license as an EMT anyway. You can attend conferences. There's state, there's local, there's national continuing education classes, there's seminars, there's lectures, and there's even stuff you can do online to maintain that education and stay current. So try to be resourceful, work with other personnel, attend training, and stay educated. So, how are you going to refresh your knowledge and stay current once you're out of the classroom? Well, in Nauvoo, we have continuing education continually, and we practice things, and we get continuing education hours that you can put towards your EMT renewal. What qualities would you like to see in an EMT who is caring for you? And do you have those qualities? If somebody else wants, if you would like to see those qualities in an EMT caring for you, wouldn't somebody else like to see those qualities in you? Where are you going to work as a provider? Whether it's an ambulance service, a fire department, rural wilderness team, urban industrial settings, volunteering, there are multiple places where EMTs are in demand and can be utilized. So to be aware of those facilities, those places, and maybe find a little niche there. National Registry of EMTs. It's a registration for EMRs, EMTs, advanced EMTs, and paramedics who successfully complete the NREMT exams. This is a national testing site which you would be eligible to test for once you complete the course. If you become a nationally registered EMT, you may be able to take that licensure from one state to another and work in virtually any state in the United States. This is helpful if you're going to be employed as an EMT. Now, you don't have to do that. You can also become licensed in the state by taking a state exam in Illinois. If you were to want to be licensed in Iowa, though, you would have to have the national registry testing for that, because they don't have a state test. They only have national registry. Quality improvement is a continuous self-evaluation program, and it helps you to improve in the areas and aspects that you feel that you would need improvement, and your system and your department should be doing that continually. Everybody in the organization is responsible for improving. Prepare your documentation so that it can be reviewed periodically, in areas that can be improved upon can be documented. Become involved in the quality process and report instances and ideas that you might have to improve your department and your resources. Obtain feedback from patients and hospital staff on ways you can also improve. And maintain your equipment and continue your education. Medical direction is the oversight of all the patient care aspects of the EMS system. The medical director is a physician. He oversees training, he develops protocols, he will list steps and interventions to be performed, and that's what protocols are. Be familiar with the terminology at the beginning of every chapter and in the sidelines. If you look on page 13 in your book, be familiar with all of those terms that are in the right side of the page. Medical direction, protocols, designated agent, standing orders, and then the difference between offline medical direction and online medical direction. If you have an online medical direction, that's orders from a physician that's on duty, that's acting as medical director, and that authority is given directly to the EMT in the field by radio, or those orders are given directly to the EMT in the field by radio or telephone. So you're getting a verbal request from the doctor to say, put oxygen on your patient. Whereas if you didn't have that medical director on the telephone or on the radio, and your patient was having chest pain, a lot of times there are standing orders, so you don't have to contact them. These are in the form of protocols that says, if you have a patient with chest pain, you should probably put oxygen on them. Your role in public health. Injury prevention programs, maybe a fall program for geriatric patients or the elderly that are prone to trips and falls. A prevention program for youth wearing bicycle helmets or even car seat for the infants. Vaccination programs, and then maybe disease surveillance and looking out for any outbreaks of perhaps some type of contaminant or infectious disease. Research might be an aspect that you get involved in depending on where you are and what is being researched, but research develops future practices. Not all of the procedures that you're trained to perform have been developed as a result of research. EMS is still fairly young in its ability as far as, and it's hard to get good evidence-based techniques that are being utilized because there's very little research out there of what actually works in EMS, and research has only just been over the last maybe 40 or 50 years as they've developed best practices for EMTs and paramedics and in ambulances. So you'll still see a whole lot of research coming in the future. Evidence-based process is the process where you form a hypothesis. So an experienced provider might decide that a new medication might be better or more beneficial to use on the ambulance. And so they'd go to their medical director and say, I would like to use this new medication in our ambulance if maybe we could. Well, the doctor might say, okay, review the literature and evaluate any evidence. If there's no literature, you would maybe do a complete research project on your own to see if that medication might be more beneficial, and then adopting the practice if evidence supports it. So there are some areas that are heavily involved in research, and we've both had changes in our practices, or even a reaffirmation of our practices based on research. Not all research is created equal. Most generally, you need to rely on a scientific method of researching, an unbiased approach in a controlled group of individuals. It's hard to get a controlled group of individuals in EMS when so many different things are happening, and it's hard to predict when they will happen. So it's hard to extract any comprehensive studies, and it also takes a lot of time. But if we can do that, and we find a way to do that, we may be able to obtain an objective opinion and be able to get some pretty decent research. So there is a couple of different methods of reducing bias out there. If you look on page 17, it's going to talk a little bit about prospective versus retrospective research. Retrospective research basically is what's happened in the past. So you look back over a bunch of runs and say, oh, well, it seems to me there's a trend of something specific happening, and maybe if we would do this, we could help alleviate problems in the future. An example of this on a local level might be, we in Nauvoo had a significant number of calls that were diabetic calls, and there was a time where we did not have the capability to do a blood glucose analysis. And so we had a number of individuals that we really didn't know what their blood sugar was. This may or may not have been detrimental, because if you have somebody that's experiencing specific signs and symptoms, it doesn't hurt them to give them more blood sugar if you suspect that they have a diabetic problem. But it's much more helpful to have a glucose analysis. So a retrospective review of our cases of diabetic patients, we determined that it might be beneficial to us to give better care by actually providing a blood glucose. And then we went to medical direction and ended up having to actually go to our state and involve politicians to try to get that change, that we would be able to do blood glucose analysis. Generally, another way to reduce biases is to just randomize the testing, and some control groups are put together and then random tests are done. They do this a lot with medication studies to see if a medication works for any specific condition. And in that case, they have a certain control group, a group of people that don't all meet the same criteria. And then some of them are given the actual medication, and some of them are given maybe a little saline or a sugar pill or something. And then they see if they see the expected outcome in the patients that have taken the actual medication versus the ones that haven't. So some types of medical research would be case studies and case reports, or maybe even using a control group and case studies, randomized controlled trials, and then do a systematic review, and then actually performing a meta-analysis, which is not a study itself, but rather it's a compilation of a lot of different studies looking at a single topic, and then summarizing that work based on all the studies and get a more complete outcome. So, the basics of EMS research, as they put it into categories, the levels of evidence, and this is designated by the American Heart Association, and this just gives you an idea as to whether they think something will work or whether it won't work. And a level 1 evidence, this is the highest level. That means that it's most valuable and that the set of data would result from an actual randomized controlled trial. So this has been a complete study where evidence has proved that it's probably a good thing. Level 2 evidence would be without the randomized trials, but the high likelihood, but it's still not as reliable result as an evidence 1. And then all the way down to an evidence level of 5. And unfortunately, level 5, the data is prone to a wide range of interpretation, and we can assume that it might work in some circumstances or maybe not in others. Unfortunately, a lot of EMS research comes into that category. So when you evaluate a study, when something comes out in a trade magazine, which an EMS magazine, you want to look for and identify whether there's any biases or flaws in how they actually produce that research. And then ask questions before you participate in any study to see if it's going to be a high quality study. Questions that you might ask before you participate in a study is, what is the title of the study? Who are the principal investigator and primary contacts? And do they have a personal or private agenda? What is the research question or hypothesis? What is the study's inclusion criteria? Who gets to be in it? Who isn't going to be in it? Sometimes that's how they control the results, is if they don't do a randomized inclusion or a randomized control. What EMS data is needed for it, whether or not you can get consent from whoever you're doing the study on, if it's going to be randomized, how will that happen, and then what samples you might need collected, what are the benefits to the patient, is it actually going to produce an improved outcome or an improved practice. Potential risk to the patient. What institutional review board has approved the study? Has your medical director approved it? Has your agency, any administrative people, approved it? So some special issues. Throughout the course, we're going to talk about local issues, about national issues. We'll try to get as much information as possible. Rely on your books, read your chapters, come to the class on Tuesdays and Thursdays, and come to the meetings, and we'll continue to update you on what it takes to be an EMT. Anybody with disabilities, let us know how we can help you. And as a quick review, this is your Chapter 1 review. The EMS system has been developed to provide pre-hospital as well as hospital emergency care. It includes 911 or another emergency access system. We've got dispatchers, EMTs, emergency department people, physicians, nurses, physician's assistants, and other healthcare personnel. The EMT's responsibilities will include safety, patient assessment and care, lifting, moving, and transporting patients, the transfer of that care, and then patient advocacy. You need to have certain personal and physical traits to ensure the ability to do the job. You need to be able to lift about 125 pounds. You need to continue to refresh your training once you're an EMT and stay current in your education. Be involved in quality improvement and medical direction are also required to maintaining high standards of EMS care. Remember, EMS dates back to Napoleonic times, over 100 years, but modern EMS began, you can track it back to the roots in 1966 with the development of what they called the white paper. It was called Death and Disability in America. There is a chain of human resources involved in EMS, and each person in that chain is responsible for making critical decisions. We want to help you to make good decisions in critical times. There are certain personal and physical traits that help you to become successful. Be friendly, be professional, be courteous, be empathetic. As an EMT provider, you should actively pursue opportunities to improve your personal knowledge and abilities, as well as the unit's overall quality. What innovation was introduced in the Korean and Vietnam Wars that is now common in many EMS systems? You can look on page 3, and if you look, it says, during World War I, many volunteers joined battlefield ambulance corps, and during the Korean conflict and Vietnam War, medical teams produced further advances in field care, many of which led to advances in the civilian sector, including specialized emergency medical centers devoted to the treatment of trauma injuries. Trauma centers. What are the 4 levels of EMS providers? That would be the EMR, the EMT, the advanced EMT, and the paramedic. Requesting orders from a physician by radio is an example of what kind of medical control? If you have the voice contact with them through a radio or a cell phone or a telephone, it is online medical direction. Your patient is hesitant to go to the hospital because she is worried about her dog. What can you do to assist in the situation? Well, if you can if there's time, find a neighbor or somebody that could care for the dog, or put the dog in the place where it'll be safe until the person gets back. What part of your role as an EMT is this an example of? This is being a good patient advocate.